Yes, sir, Bob? Is it?
The,
Both.
were you pointing to me?
Yeah.
The price of medication, I suppose, is regulated.
Absolutely. Okay.
Absolutely.
In the United States,
$1,000 pills and all
right.
that.
In the United States, the price of drugs is not regulated. To put it simply, it's more complicated than that, but it's not regulated. In France, it is regulated.
Okay, yes.
And the government negotiates with Pfizer and Merck and Sanofi, and the government says, we will take your drug for this price. And Sanofi says, no, that's not enough, and government will say, well, then it's not going to be available in France. So take it or leave it. And the same drugs turn out to be available at about half the cost, third of the cost. Okay? Because the pharmaceutical companies don't want to lose that market. And they're making a profit on it. But just not as big of a profit as they make here, I should say, in the US. Okay, let's look at the cost. It's about $5,000. So it's more than the UK, less than Switzerland and France. Okay? And the life expectancy is very good. Okay. Here we are, okay, finally, right, the United States, okay? So by using these same simple criteria, life expectancy, 81 years. It's much shorter in the U.S. It's one of the lowest life expectancies, number 34, among the high-income countries of the world, okay? Well, let's go through this list and let's talk about why life expectancy here is so short, okay? Now, 81, is that short or not? Well, for most of us in the room, we just as soon make it past 81, I would say, okay? And mind you, that's the average, okay? So the women are going to be about 83, and men are 82, and men are going to be probably under 80, okay? Who's covered in the United States? Well, about 80 to 90% of the population is covered, right? Not 100%. And we're going to talk about the Affordable Care Act, or Obamacare. When it was enacted, the uninsured rate was about 15% in the United States, okay? With the Affordable Care Act, that's dropped. It dropped as much as half, so down to about 7%. Over the last 2.5 years, it's increased again. The current administration we'll talk about, is opposed and has done things to decrease the attractiveness of the Affordable Care Act. So we're back to about 90% of people in the United States covered. Who regulates it? Basically nobody. I mean, when you think about it, this is a health system that just Jefferson won, okay? Adams didn't. It isn't centrally controlled. It just is whatever it is. It's a classic, and we talked about this in one of my previous presentations. It's a classic example of grassroots capitalism. You just start it and do it, okay? When I started my office, I was in private practice. I went, had a partner, started my business. That's it, okay? If I didn't work, I didn't get paid. If I worked, I got paid. It's unregulated, largely unregulated, okay? Now, that simplifies it. The government plays roles in regulating, the hospitals regulate, the accrediting people regulate, okay? So it's not really a free-for-all, but it is certainly not a system that is regulated.
The insurance companies regulate some.
The insurance companies regulate some, but don't forget, insurance company A and insurance company B are going to have different regulations. So you have to comply to their different regulations, okay? So how can you have a system when there's that much chaos? Yeah.
So, but could you say, at least to a small extent, here in the U.S., there is some regulation at the state level? Because we have a lot of variation. Massachusetts, for instance, offers much more in terms of state health care than others.
It is, in fact, the state laws that control things like medical licensing and hospital accreditation. Well, hospital licensing. So a lot of it is at the state level. And it varies from state to state. That's right. Okay. Right. So we're in a relatively conservative state. We're relatively less regulated than Massachusetts or New York. Okay, let's keep going here. Who owns the hospitals, the doctors, the clinics? They're mixed. Okay? We actually have, remember, we've got a VA system, military health care. Okay? We've got Kaiser out on the West Coast. Okay? Oh, well, here too. Kaiser's here too. Sorry. The net out of all this is that there's really no system. Most of the doctors get paid most of the time fee-for-service. I'm simplifying this. There are exceptions and so forth, but simply put, this is a system in the United States that's fee-for-service. Who pays? Everybody, nobody, somewhere in between. So you've got employers who pay, employees who pay, people pay out of pocket a lot of money, as many of us have experienced. You know, you go to get a drug, you're paying $75 for that drug for this month, but I have Medicare Part D. What happened? You're paying. They say they're paying, you're paying too. And the government pays. About half the cost of health care in the United States ultimately is paid by the U.S. government, federal government. Medicare, Medicaid, VA, military medicine, okay? And it's very expensive, $10,000 per person per year. Very expensive. Okay. So here's a quick comparison of the numbers that I gave you, okay? And a lot of times we talk about the percent of GDP that is spent, and the U.S. has spent 18, I think it's down to 17% now, of our gross domestic product on healthcare. It is a big, big business in this country. Big business, okay? And the argument that most people make is that we in the United States don't get what we pay for. In these other countries, they get what they pay for. The British pay less, they get less, but they're happy with it. The Swiss pay more, get more, and they're happy with it. And the French pay less, get more, and they do pretty well for themselves, okay? All right, now, got just a little more to go. For those of you who heard me do this before, I showed you a picture of Alfred E. Newman, which from our generation we can recognize from Mad Magazine, particularly the males, okay? And when I first started talking about health policy, the Affordable Care Act didn't exist yet, and I predicted that there would be some health care reform. And I said, the government will birth a baby, but it's going to be a sick baby. Okay? And I said, how do I show a picture of a sick baby? So I took Alfred E. Newman and made him yellow. Okay? So this is my version of a sick baby, and I would contend that the Affordable Care Act is a sick baby. We have it. Okay? It's insured 7% more of the population than got insured, but it's not so hot. So in our remaining 7 minutes, what we're going to talk about is where do we go from here? Okay? So, do we have Medicare for all? Think about that for a minute. Medicare would be like probably the French healthcare system. Okay? Everyone is covered. The government regulates it. Government sets the prices, but it's more or less privatized from there. The vast majority of you have Medicare right now, right? Okay, you have a very good understanding of what it is and what it isn't. Okay. Do we change the Affordable Care Act? And does the baby get the surgery that it needs? That's what this is supposed to mean. Okay. Right? Because many people say that it needs to be revised. And that's what Joe Biden is saying, okay? Right? Some people are I heard the debate of the Democratic candidates, and some of them were kind of quiet, okay? But they were basically saying, let's continue the Affordable Care Act. Some said, let's revise it. Some just didn't talk about it, which is to say they just wanted it to stay the way it is. Okay. And then, of course, there have been efforts to discontinue the Affordable Care Act, okay? Right? Very strong efforts over the last 2.5 years, okay? Very serious. I mean, right? They've tried and they have not succeeded in the Republican Party, okay? So, as we just have 5 minutes, but what I want us to do is I want us to decide what we would do, okay? let's vote. So I've put up our goals over here, okay? Again, thank you, I'm gonna add compassion the next time we do this, okay? You want everyone covered, everyone is treated fairly and equally, you want an effective and you want an efficient system, okay? So let's take a couple minutes. I would ask somebody to volunteer to propose Medicare for all. Tell me why you believe in that, or why it should be believed. And then we'll go through these, each of these for a minute. Anybody want to promote it, Medicare for all?
How do you define Medicare for all?
Okay, you have Medicare right now?
I do.
Right? So right now, Medicare, to be eligible for Medicare, you have to either be disabled, on renal dialysis, or age 65 and over. Okay? So you change the eligibility to everyone, and it otherwise stays exactly the same.
But everyone can be covered and it's still not be Medicare for all.
What do you mean? Oh, yes, that's correct. You could have a different system.
Yeah.
Yeah, right. You
So
could-
it's, I
right.
don't see it as a binary choice.
You really don't. I've simplified it. Right.
Okay.
You could create, right, you could create another system. That's correct. Okay?
Richard, I think one of the arguments of the people who talk about Medicare for all is, while it is a big government, huge government thing, it's relatively efficient. I mean, it's relatively simple.
Yes, okay. So I am personally a proponent of this, okay? And one of the reasons I am is that administering Medicare costs something like 2 or 3% of the cost of Medicare. If you look at United Healthcare, which is a big private employer, insurance for private employees, it's 30%. What that means is that 30% of the money that you pay in premium for United Healthcare goes to the insurance company for its profits and its management. The equivalent is done by the government at 2 or 3%. Surprising to many people, but it's actually, Medicare is pretty inexpensive. Why? Because Medicare doesn't own anything. It pays into a privatized system. Yes, ma'am, and then Perry, and then somebody over here.
No, I just was gonna say Medicare for all, but Medicare doesn't pay for everything. You still have to have another policy.
Right.
So when you put Medicare for all, do you mean now it's gonna be cover all your medical needs? Oh,
I don't know, okay, I don't know. I mean, I think, you know.
I mean, but in these other
It would be
countries
so
like
complicated.
France, does it cover dental, vision, hearing aids, that kind of stuff?
If you go to the UK and you look at people's teeth, you know that they don't have dental coverage.
I know they don't in UK and Canada, but I was wondering
In
about
France,
France.
in France they get some. I think they do. Children get covered. I think
Okay.
for sure. Okay. And adults probably get. In some of these countries, I don't know for sure. Some of these countries you get reduced. The government kicks in some money for things like dental care. Okay. So it's variable. And if we created Medicare for all, then one of the questions we would ask is, what do we mean by that?
Exactly.
Are you going to have supplemental? Are you going to have Medicare D? You're going to still have Medicare C? All this kind of stuff, okay? Most of you have Medicare. Medicare A was created by the Republicans, and Medicare A was created by the Democrats. Medicare B was created by the Republicans. Okay, right?
Yep.
Okay. So, do you just keep Medicare exactly the same way it is? This is what Bernie Sanders and Elizabeth Warren are apparently saying.
So then you still have to have another.
Still have to have another policy, right? Okay, or two. You have to have
Yeah.
Medicare. Yes, ma'am.
The doctors I know hate Medicare because it does not pay them and does not pay for the services the doctors want to give you.
Yes, many of my colleagues in medicine say that, and I personally disagree with them, okay? Because I think it pays pretty good. It just doesn't pay as much. And if all I had to deal was Medicare, and I didn't have Blue Cross and United and Aetna, I would have fewer people working for me. My costs would be much less. And I would contend that physicians' incomes would be pretty much the same. But many people complain about that. You're right, because they make more money doing a knee operation with United than they do with Medicare. Okay, we got to finish in a minute. So,
So the difference in Medicare for all and the next one, the Affordable Care.
okay, so the next one is you keep the Affordable Care Act, but you make it better somehow. okay? Make it better. More people are covered. Half the people who are supposed to be covered aren't covered. What do you do with that? Do you contribute more federal money into it? Do you make eligibility different? Do you create a Medicare option for people to buy into? This is what the Obama administration wanted to do, and it got pushed out of the Affordable Care Act. So how would it be if you were 55 years old and you could pay a premium to get Medicare? That's what a lot of people are talking about now. Okay. We have to have our vote in 1 minute, so we're going to just run through this. Do you keep the Affordable Care Act exactly the way it is? And then finally, do you believe that the Affordable Care Act is a waste of taxpayer dollars, that it's unfair to working people, that it should be eliminated? Okay, right? Because there are people who have been proposing that. Okay, so let's have a show of hands, and we got to stop. How many people would do Medicare for all? Okay, how many people would revise the Affordable Care Act? Okay, how many people would keep the Affordable Care Act exactly the same? And is there anyone who would eliminate the Affordable Care Act? Okay.
If you do Medicare for all, you.
Then you would do that, right? Now, remember, just one quick point just to explain, because we've run over. This only affects 7% of the current population, the Affordable Care Act. You're not, if you have Medicare, the Affordable Care Act has no impact on you, right? There are some, but it's kind of a long story. It's pretty minor, right? So to eliminate the Affordable Care Act or to change it really wouldn't impact the current Medicare program. Okay, I'm sorry we didn't have more time to talk at the end, but we got to stop. Thank you all for coming, and I hope you got more out of this than when you started. Okay, thank you. All right, thank you. Thank you.
Thanks so much.
Very good. You're all welcome to come in.
More lunch and learn at Friday.
Right? Yeah? No, they good?
You didn't sign in, please.
Yeah, we can talk about this.
I really enjoyed it.
Oh, good, thank you. Thanks for coming. It's nice to see you.
Nice to see you.
Yeah, thank you.
You're gonna be around all summer?
No, we're going about 3 weeks away. Thank you. So you've got all these different exposures.
Yes, I had 30 years of Medicare for all.
Where was that?
Canada.
Yeah, it's a good system.
Is the average life expectancy really a good measurement for healthcare?
Hold on one second.